Hello everyone, Radhe Radhe, welcome to my channel. Today we are going to discuss an important concept in research methodology from practice-based question to evidence-based decision making with the help of an example. Have you ever wondered how everyday professional experiences can become the foundation of meaningful research? How simple observation can lead to the better decision making, improved services, and stronger communities? So let us understand this through an example from the healthcare sector. Imagine that you are working in the field of healthcare. You may be a frontline healthcare provider, a supervisor, a health administrator, or even a policy planner. You may be working in a hospital, clinic, rehabilitation center, or serving as an outreach community health worker. Your professional role could be that of a doctor, nurse, physiotherapist, occupational therapist, social worker, or any other paramedical specialist. Regardless of your position, your everyday professional practice naturally raises important questions. Some questions emerge from your own observation, some are asked by the patients, some by colleagues, administrator, or even the community. And these questions often demand systematic investigation and the evidence based answers. So, here the role of research appears. Let us take some example of such questions. You may ask yourself, how many patients do I attend to on a daily basis? What are the most common health conditions observed among my patients? What are the major cause and contributing factors behind these conditions? Why do some individuals develop a particular health condition while others do not? What are the specific health needs of the community I serve? How beneficial is this healthcare program for the community? How can I demonstrate the effectiveness of the services being provided? Why do some people utilize these services while others choose not to? What are people perception and experience regarding the service? How satisfied are patients with the quality of care they receive? How effective is the service in achieving desired health outcomes? What improvement can be made to enhance service delivery and the patient care? So you can see that all the questions are raises are research questions. So, these are not just routine operational questions. These questions form the foundation of research and evidence based decision making. When professionals systematically explore such questions, they generate the meaningful insights. These insights help improve service quality, strengthen professional practice, and create a positive impact on individuals as well as communities. So, it means that we can say why research matters. So, research mainly help us to identify the patterns, trends, and emerging the health issues. If we consider the same example of healthcare sector, understand the cause and risk factors associated with different conditions, assess the needs and expectations of patients and communities, evaluate the effectiveness and impact of programs and services, measure patient satisfaction and service quality, generate evidence for informed planning, policy formulation, and decision making, develop innovative strategies for improving healthcare delivery and outcomes. So it means that research transforms the everyday observations and questions into actionable knowledge for professional growth and community well-being. It totally depends on the perception, thinking, and attitude level of a researcher. So we can say that research transforms our everyday observation, daily questions, and professional experience into the actionable knowledge. Such knowledge supports the professional growth, personal development, better decision making, and community well being. Always remember every important research study begins with a meaningful question. Thank you so much for watching this video. If you found this video useful, please like, share, and subscribe to the channel for more insights on the research methodology and professional development. See you in the next video. Thank you all.